Hey everyone, welcome to our YMCA education series. Today we have Denise Schwartz with us today. Denise is a licensed physical therapist and owner of the Manual Touch. Today Denise will be helping us understand hip pain and how to heal it naturally and give us some tips and techniques to help us with that. On behalf of the YMCA, I thank you and welcome to be here, and we're looking forward to learning. So thank you, Denise.
Thank you. Okay, I'm gonna share my screen. Okay. And you can see my mouse, right?
Yep, we can
And
see
it's
it all.
loud enough?
Yeah.
Okay. All right, great. All right. We'll get started. Thanks, Amy, for having me. I always love providing these educational webinars to the Northbrook YMCA community. I'm very passionate about providing education so people can learn how to take care of themselves so they don't get injured. As Amy said, my name is Denise Schwartz. I'm a physical therapist and the owner of the Manual Touch Physical Therapy in Wheeling. We use a whole body approach of traditional and non-traditional therapies to get people back doing the things they love to do. A couple of years ago, here's my son, Drew, he asked me to help him with some injuries so he could return to triathlon racing. Drew, who is now 27 and married, began doing triathlons at age 14. And soon he wound up winning his age group in every race he was in. He even competed at the junior elite level. And then once he got to college, he competed for his college team and became nationally ranked as well. For those of you who don't know what a triathlon is or don't remember, it is a 3-sport race where the athletes first swim, then they run, then they bike, and then they run. Okay. Drew took a couple years off after college to nurse some injuries and to adapt to adulthood. He decided to make his return to triathlon racing at the Pleasant Prairie Race in Wisconsin, where he would swim a half a mile in a small lake. He would bike 12 miles, and then he would run a 5K, which is 3.1 miles. First, what we did with him is I videotaped him running on the treadmill so we could analyze his running gait. And I provided him with some running form recommendations. I gave him some spot-specific exercises, and I did some hands-on work to help him get over his injuries. But most importantly, what I provided for him was reassurance and guidance to get him safely to race day so he could prevent his injury from becoming worse or preventing him from racing that day. There were many a night I would get a phone call from him. Mom, my hip hurts today. Oh God, I don't think I can run. My calf hurts. So I had to talk him off the ledge, kind of maybe tweak his program a little bit, or let him know that's okay. It's all right. You can keep doing your training plan. So we got him to race day. The Pleasant Prairie race was unique in that it attracted a lot of para-athletes. A para-athlete is an athlete with a disability, such as paralysis, amputation, blindness. I saw athletes running with the prosthetic blade. I saw athletes biking with and without the prosthesis. I saw athletes being carried into the water so they could swim, but they couldn't walk. Now, my son's rehab took about 6 months to get him race ready. But I can guarantee you those para-athletes, it took them many years to get to that point. And more than likely, at the beginning of their rehab, whether they were born with a disability or came on later in life, a triathlon probably wasn't their primary goal. Their primary goal was to learn how to live with their new disability and limitations, how to sit, how to stand, how to get dressed, how to move around. But as their rehab progressed, they could develop new goals and higher level goals. And eventually, these para-athletes had, in order to compete at a triathlon level, they had to accept their disability and not let their disability or limitations define them. because you never know what you can do when you set your mind to it. Now, watching these athletes and parallel athletes compete, knowing the dedication and commitment it took to get there, and working with athletes like this really reminds me of why I really love what I do, because I never know what someone can accomplish when they set their mind to it. Now, maybe triathlon isn't your goal. Maybe all you want to be able to do is walk without pain, or sleep without pain, or get back to playing golf or some other activity that you like to do. Or maybe you just need to be able to do everyday activities like standing in the kitchen and cooking and hanging out with your friends. So today we're going to talk about hip pain, the most common diagnosis, get a better understanding of what the hip is all about and how it relates to the rest of your body, and some things that you can do about it. So people with hip pain typically, shouldn't say typically, often complain of pain with sitting. Maybe they're fine sitting, but after they sit for a while and they stand up, then they have hip pain. They say they can't lay on their side to sleep. Walking, sometimes the hip pain hurts the whole time they're walking. Sometimes it's after 20 minutes. They have difficulty putting on their shoes and socks, rolling over in bed. They can't do the activities they like to do. They can't run, pickleball, tennis, whatever it might be. What you first want to know is, where do you have the pain? And the hip is a very large, very mobile joint. And a lot of people call their pain hip. And so we need to know, what do you mean? It could be in the front of the hip, it could be the side, be the groin, or it could be in your buttock. Sometimes people call it their hip. It's not really their hip, but that's why we have to discern where it's really coming from. So what are the most common diagnoses that I see? People have arthritis. That's where the joint degenerates. Tendinitis or bursitis somewhere in one of the muscles surrounding the hip. Or they may just have weakness. Yeah, everybody who has arthritis or tendinitis will have weakness. However, sometimes people are just weak over time, and they don't necessarily have those other two. Here is your skeleton. This is your hip joint. And you can see the hip joint is part of your femur, your long thigh bone, going into the pelvic bone here. And what's important to look at the skeleton is how everything is connected. You know that song, the foot bone's connected to the knee bone, to the shin bone? Well, it's true. So even though you might be having a pain or an issue going on here, it could be because of something else going on somewhere else. So it's really important for us to look at your whole body to discern where may be contributing to that pain. And you can see from these dancing skeletons that, you're bouncing around on their feet, and maybe your foot's not working so well. And as a result, your hip can't accommodate. And then you wind up getting a problem in the hip, even though it really started with your foot. Another issue that's important to know is the difference between genders, women and men. Women have wider hips, and as a result, the angle from their hip joint down to their knee is bigger. And so women are sort of what's the word? I want to say conceived, but I'm not sure that's the correct word. Predetermined to easily get weakness in their hip, and a problem, particularly in the outside of the hip joint here, the lateral hip muscles. An easy adjustment that you can make, women and men. I give this piece of advice to almost everybody, because a lot of people tend to walk with their feet one in front of the other, almost like in a straight line. Walk with your feet further apart so your feet are underneath your hips. You can see here her angle has decreased quite a bit from what it was here, because her foot is closer underneath her hip. Okay, it's going to feel really weird at first, But after a while, you'll get used to it and it will make a huge difference. Not only will it provide better balance and support because you'll be landing right underneath your body. And I recommend you start off doing this for like a minute and then don't think about it when you're walking and then do it again. Eventually, you'll be able to do it all the time. Very important. For more tips on what you can do throughout your day, I have an ebook here called Mindful Tips for Daily Movement, how to sit, stand, sleep, etc. So if you would, I would love to send this to you. In addition, I'll also send you this PowerPoint presentation. If you put your first and last name and your email in the chat box, and I'll get it out to you by the weekend with some other information as well. All right, so let's take a closer look at the hip joint. Here is your hip joint. It is a ball and socket joint. You can see this is kind of looks like a round ball. It's called the head of the femur there. And it sits in a socket in the pelvic bone, which is called your ilium. The socket is called the acetabulum. A point here, so the femur comes up straight and then it bends in, and this is called the neck of the femur. This is where a lot of fractures happen, in the neck of the femur. This is the greater trochanter. It's a bony prominence on the femur. Almost all of the hip muscles attach here. There are a lot of hip muscles that we're going to look at in just a moment. In this picture, you can see your spine and how the pelvis is connected to your spine, which is then connected to your femur, and then all that way down the line. There's a very large muscle that comes from your spine and it goes all the way and attaches onto your femur. This is your hip flexor. This is the muscle that allows you to lift your leg, to march, to go up a step. When you're sitting, this gets kind of short. And so when you stand up, sometimes you get pain here in the front of the hip, and it can be this muscle. What's important here to know is that because it attaches to your spine, there may be something going on in the spine that may be pulling on this muscle, which is then causing pain all the way down here. So we really want to know all those pieces. These are the inner groin muscles. Now, when people have degeneration in the joint here, arthritis, when it gets really bad or, pretty significant, usually or quite often the telltale sign is people have pain in their groin. So it's important for us to discern, is that groin pain coming from the hip joint, or is it because you have a muscle strain or tendonitis in the groin, one of the groin muscles here? Another telltale sign of hip degeneration is upon examination, the hip joint has lost mobility in certain movements. So the hip can rotate, it can move out and in, it can go back and forward. And if you lose a significant amount of mobility in one or more of those directions, then it's really important to get an x-ray to determine if it's actually degeneration. There are a lot of muscles that surround the hip. And these are the superficial muscles, meaning these are all the big muscles on the outside. You have your big glute muscle here. There's 3 glute muscles. This is the big butt muscle. This is the glute medius. This is a really important muscle that helps you balance. People, as they get older, tend to get tears in that muscle, which contribute to a significant amount of weakness. This is your IT band. A lot of people might have heard of that. And even though this is on the side of your leg, people usually feel pain down on the outside of the knee or just below the knee on the outside of the shin. The IT band, when you get IT band pain, it's because you have weakness up in here, usually in this glute medius. You can have a tendonitis up here or a muscle strain here in the tensor fasciae lata, which is a muscle that attaches the IT band. You can have a tendonitis in this glute medius. You can have a tendonitis in the deeper hip muscles. These are actually your pelvic floor, deep core muscles. And you can see they all attach here onto your greater trochanter. They rotate your hip. But what they most importantly do is they actually stabilize your pelvis as you move through the world. 9 times out of 10, when people come in to see me, this is the problem. These muscles have turned off for some reason. They fatigue easily. They're very small, so they don't work very well. So this is where we need to get to. So those of you who haven't gotten better, working on all sorts of strengthening out here, it could be because it's a deeper muscle in here, and we have to do some real spot specific exercises for them. This is a close-up of the pelvis on the back end. And what's important here is understanding how here's your vertebrae, this is your sacrum, and here's your pelvic bone, your ilium, is this joint, your sacroiliac joint. Sometimes people come in and say they have hip pain, and this is actually where they have pain. It's really an SI, sacroiliac joint problem. Sometimes that's all it is, and we need to do some manual therapy, and it's taken care of. Sometimes the sacroiliac joint gets acting up in response to the hip joint not working well because you have some degeneration in there. And I have seen that. Sometimes, so when this sacroiliac joint rotates a bit or gets a little stuck, then the muscles that are attached to the sacrum here get strained and can compress the sciatic nerve, which goes down the back of your leg. So sometimes people will have some pain down the back of their leg because of that. Your core, have you all heard of your core muscles? These are all of your abdominal muscles and all of your back muscles and all of those pelvic floor muscles make up your core. This is how you need to function. If this is not working well and not being activated when you move, then you get a problem somewhere. A little trick I teach people to engage their deep core muscle called your transverse abdominis. Put your tongue on the back of your top teeth and make a TH sound. In order to make that sound, this muscle has to contract. Now, technically, this muscle should be subconsciously activated all the time, but for some people, it turns off or it fatigues easily or it doesn't work so well. And people aren't aware of it because it's so subconscious. So that little trick teaches you what it should feel like to engage your core muscle. Something that's a concern for you is the aging process, and that we have to educate people really importantly on the aging process. As people get older, you lose muscle mass, bone integrity, and as a result, your balance and flexibility become less and less effective. And then you can't walk as well, and you're more prone to falling. So it's really important to stay on top of strengthening and balance. A big component of people's issues with hip pain or any kind of pain is neuromuscular control. And that is your body working together. So I have a patient, her name is Kathy, and she is in her late 50s and she had a total hip replacement and a glute medius repair for a tear. And prior to the hip replacement, she had a labral tear, which is a tissue inside the joints. She had a lot of stuff going on in that hip. She also has some other medical history that contributed to some pelvic floor and core issues. She was receiving therapy elsewhere for many, many months. She was very diligent about doing her exercises and just couldn't quite get rid of her hip pain. And this is after the surgery, and just wasn't getting stronger. And she came to see me, and we realized her pelvic floor, those deep core muscles, if you remember back here to right here, were not working well at all. Probably were not working well for many, many, many years. So we have done a lot of work to teach her body how to get her foot working to activate her core, to get all this connected, neuromuscular control exercises. And when she came to me, she just wanted to get rid of the pain. She wanted to be able to walk and sit. And you know what? She's playing pickleball now. Never would have expected that. That wasn't her primary goal. But as she went along, she was able to do that. So it's a really wonderful success story. And she's getting stronger and stronger little by little. It's very difficult to get that hip muscle stronger after a total hip. It has been weak for a very long time, and it's very difficult to get it back 100%. But you can get it stronger. I'm sorry, I don't mean to make it sound really negative there, but it is a challenge and it takes a while. So what's the biggest mistake people make with hip pain? They ignore it. So Diane came to me a couple of years ago and she said, both of my hips have been tightening up over the last few years and now they're really very tight. I have difficulty putting on my shoes and socks. I've still been working out. I don't have a lot of pain, but they just don't move very well. Well, upon examination, she had lost a lot of mobility in the hip joint itself, and all the soft tissues around that joint had tightened up. Because it was so bad, I'm like, you need to go get these hips x-rayed. I think you need a total hip replacement. And sure enough, she did. She needed both hips done, but she only got one done. Usually you only do one at a time. And she came back to me afterwards. And because she had waited so long, all those soft tissues that had tightened up before the hip replacement doesn't change soft tissue change. We needed to work really hard to get those soft tissues to loosen up and open up so she could get the mobility that she needed. Little by little, she got better, but it's still not 100%. So it's really important when something is starting to feel off to get it checked out and take care of it much sooner than later. I had another young woman, maybe in her mid-50s. She'd had a year of hip pain. She's just and she liked to bike and walk, and she just struggled with it. She finally came in to see me. I saw her 2 times, gave her some exercises, gave her some treatment, and now she's biking and walking pain-free. But she didn't have to suffer for a year, but she waited too long. So really important to get it checked out sooner than later. How do we know if therapy will help? Well, is your pain reproducible? So my friend Dan, he has hip pain after walking 20 minutes, and then he really just can't walk anymore. That's reproducible. Someone comes in and says, I'm okay when I'm sitting, but then when I go to stand up and begin walking, then I have pain. When I lay on my side, I have pain. So that's reproducible. People have pain all the time. Nothing spot specific sets it off. That's not reproducible. That's really important to get checked out medically to make sure what's going on. And sometimes it is a musculoskeletal issue and it means you need a total hip or something else, or it could mean something medical. Anyway, so Dan came to me and I videotaped him walking, and he had the funkiest gait you ever saw. He reminded me, do you remember the image back in the 70s of Keep on Trucking? Where this man, it was a cartoon, it was a drawing where he stepped out really far out in front and his little feet were way out in front of him. That's kind of how Dan walked. And he didn't swing his arms, and it was obviously, to me, he did not use his butt muscles at all. I gave him some exercises. I talked to him about walking with his feet the hip width apart. I had to really work with him to start learning how to lean. Excuse me. How to stand up straighter. And so he wasn't reaching out in front. And he just got back from Utah and he was walking without pain. So it was good that he finally came in and we took care of this. Sorry, I just got over a cold, and so. So we talked about ignoring it. That's one of your choices. You can ignore it and hope it goes away. And then, things can escalate. You can use some medication, injections, or surgery. And there's a place for that. But hopefully we want you to handle it and come in for some physical therapy sooner than later. Quite often you need some medication coupled with therapy. Sometimes you need an injection coupled with therapy. If you're going to have surgery, Coming in beforehand might get you in better condition, and then afterwards as well. When someone comes in for therapy, we want to hear your story. Oftentimes, we are the first person in the long line of healthcare providers that you've met with who are hearing all your entire story. We want to know every surgery you've had, every accident, any injury you might have had as a child, because that time you fell off the bike and landed on your head when you were 8 years old could be contributing to what's going on now because you've been compensating for so many years. So it's very important to know all those, that huge story that you have. Then upon examination, we look at your mobility and your strength. And then we take all those pieces like a puzzle and put them together and try to figure out where do we need to begin. Kind of like doing the border of the puzzle first. It's really important to know where to begin. My friend Dan, his wife said, he doesn't swing his arm. I think he needs to swing his arms. I said, yes, he doesn't swing his arms, but we need to start with his feet and learning how to walk first, because then his arms will follow along with his hips. So really important to kind of figure out which piece we want to start with. So how do we treat hip pain? We want to fix your mechanics. That's with manual therapy and learning how to move better, give you some dynamic stretching, balance, strengthening and neuromuscular education, exercises to teach your body how to work together. Oftentimes, I need to recommend you to go get new shoes or orthotics. So some of the hands-on therapies we do, I talked about this very briefly in the beginning. We use some non-traditional techniques and some traditional techniques. So most of you are familiar with a traditional technique. You come in, it hurts here. I put my fingers on it. Oh, that hurts. We kind of do some soft tissue work on that area to kind of break up the tissue. That's a traditional technique. We have a stuck joint. We need to mobilize that to kind of get it moving. That's traditional. And those are important. The non-traditional technique is we are looking for where are all the restrictions and tentacles that might be contributing to why you have this muscle spasm or this tender point or this pain. So we're going to look away from that area and where is the problem maybe coming from. So think of a garden hose. When the water isn't coming out at the end, do you magically try to get water to come out the end? No, we know there's a kink somewhere along that hose. Same thing with your body. Where are all the kinks in your body? And so then we address that with a much more gentler technique to work with your body. A non-traditional approach of exercise is the same thing. What movement is preventing you from that area from healing? So if you come in with a hip pain or back pain, oftentimes it's something going on down in your ankle or your foot, which isn't moving very well. And so then you overuse up in your back or you overuse your knees or something. So we need to work on the ankle or foot. Giving you exercises, neuromuscular education we talked about. And then most importantly is education. How to function on a daily basis, how to sit properly, optimally. Let's look at optimally. How to stand, how to walk, your posture, how to move through a transition, how to get up from standing up out of a chair, how to roll over in bed, how to sleep, sleeping positions, all those things that no one teaches you. We learned all that in physical therapy school so we could help you. Very important. And those are part of the ebooks that I provide for you. So if you want those ebooks, I'll be happy to send them to you. Just put your first and last name and your email in the chat box. And then, of course, let's say you're somebody who wants to get back to playing pickleball or the triathletes that I treat. You might want to get back to doing your triathlon racing. We get you back doing that. Maybe you want to be like these ladies. I met these women down in Tampa, Florida, maybe 8 years ago. I was doing a half marathon in Tampa, and I was standing in line at the Starbucks, and we talked a long time, and this was a really long Starbucks line. And they had already had medals around their neck. I'm like, why do you have medals? And they said, well, we just walked the 5K. And tomorrow, later today, we're going to walk the 10K. And tomorrow, we're walking the half marathon. these ladies, who upon asking them, aged 70 to 80 years old, and you can see this woman in the middle had a happy birthday sign, didn't let age limit what they could do. They were walking 3 races in 2 days, which was, let's see, 13, 16, 21 miles. And they were doing this to get themselves ready to walk across America. We kept in touch, and they did it. They did it in 2 blocks. They walked from Florida to mid-Texas, I think over 4 or 5 months. And then they came back some months later, I don't remember, and they walked from mid-Texas to California, and they completed it. And they had a whole system where somebody was driving and took turns and whatnot, but they walked across America. Amazing women. That's a very large goal. I don't expect too many people to do that, but they didn't let age limit them or define them, and they were enjoying life. Another tool that I've added to my repertoire is called an OOV. I love this device. This device was created by an Australian osteopath and biomedical engineer. It works your body three-dimensionally, subconsciously activating your core so you can't compensate. I can put you on your back. Here I have it between the back and the wall. You can stand on it. You can lay on your stomach or your side. The beauty of this is it takes your brain out of the picture and it activates your core. Remember I talked about your abdominal muscles and your core needing to be activated all the time? This device activates it so you don't have to think about it. And then we tailor the exercises for that. And it doesn't matter how old you are, we decide what position you can do and how it will benefit you the most. Another device he created is called a balance sit, where you sit on this and it activates your core and pelvic floor again. And again, we design the exercises to get your body learning how to get your core and your pelvic floor and your hip joint. This is very important for the hip joint to get that differentiated. Here's a friend of mine. We were out of town at a lake house and she's sitting on here. She's got one foot up, learning how to balance. This will help activate her left hip. So my son, he completed the triathlon. He wound up getting 8th place in his age group. He didn't allow his injuries to limit him or define him, and he embraced rehab. And those para athletes who completed the race, as I watched them, and all the able-bodied athletes come across the finish line with joy, they all accepted their healing process. They didn't allow their limitations or age to define them. I see quite a few in fact, I had a triathlete this morning who's 73, so it didn't allow them to limit the possibilities of what they could achieve. And I hope you too can embrace your healing journey and don't allow your age or injuries or disabilities to limit what you can do. So as a thank you for coming here today, I'm happy to give you a 20-minute phone call to discuss any issues that you might have. Again, if you put your name and your email in there, I will send you this PowerPoint, and there's a lot of links to a lot of information on my website and some ebooks I will send you. So thank you for coming. I hope you enjoyed it and you learned a lot. And I'll be happy to take any questions that you might have.
Thank you, Denise. I learned a lot.
Great.
I do see a question in the chat. They're asking about insurance, if you take insurance or how that works with your practice.
Yeah. So we are Medicare providers, and we also are in network with Blue Cross. However, we bill all private insurances, and we will find out what your benefits are. Those of you who have Medicare do need a prescription from your doctor, but if you do not have Medicare and your private insurance, you can just come in and see me or my other therapist here, and we can get started.
Great.
You know, sometimes people always wonder if they can continue doing the activities they love to do even though they have pain. So sometimes I do have to be the bad guy and tell you, you know what, it's time to take a break.
Mm,
Sometimes a guide, particularly with my runners, if they can run through the pain and they don't have any pain after they run, we might be able to work with it. We just have to tweak what they're doing with their running or their exercises. If the pain is under, on a scale of 0 to 10, 10 being horrific and 0 being nothing, and it's under a 5 or maybe a 3, usually you can keep up with the activity, but we really need to make sure we kind of take a look at your form or whatever you're doing that's causing that pain. If you have persistent pain after you do your activity for
mm.
a day or more, then you really need to stop. So that's usually a telltale sign. If you have pain at night while you're sleeping, it wakes you up, then you really should stop the activity.
So if it's just a little bit of pain, but it goes away maybe after like 30 minutes after your activity, or if you stretch it out, then it goes away. What would you
That's
suggest
usually
for that?
usually you can continue doing the activity that you like to do.
Mhm,
Again, we might tweak some of
mhm,
that. I don't know if there's any runners on here. I don't know. But we might take away. I might have them run slower, or people who walk regularly, and people who like to walk fast. I say, oh, let's slow it down, or let's walk less distance. So there's a lot of way to still keep up with your activity, but you might have to tweak how you do it.
mhm, mhm. And do you also give suggestions on like positions for sleeping and sitting, or if a lot of us might still be at a desk working? I know
Yes,
you mentioned.
definitely. That is part of it. Functional. It's very, very important. I tell a lot of people who come in, they learn their exercises well, they can do it. It's the other 100 hours in the day in that week that things fall apart. So if you're not sitting optimally, if you're not standing optimally, we really discuss how to stand the right way, or the most optimal way for you.
Sure.
Sleeping. So those are all in my ebooks as well.
Oh, wonderful.
So very, very important. It's a big, big role of what we provide. And that's why I really love doing these webinars, because I can provide some education for you and how to take care of yourself. Very important.
Mhm.
Okay, I don't think I have any other questions. Let me see if I can, hold on, don't close me out yet. Or Amy,
No,
you
no.
stay on while I figure out how I need to do this. I forgot how to copy this. Well, thank you all for coming. I hope you have a good day. I think we're gonna have some nice weather coming up soon, and good
Yeah.
luck to you. Take care.
Yeah, thank you. And I'll send a copy of the recording to everybody within a week as well, along with your contact information, Denise, if that's all right.
Yeah, that's perfect. Yeah.
Wonderful.
Hmm. I don't know why I can't figure out where. Oh, all righty.
All right. I hope everybody has a great day. Thank you very much.
Well, I guess I'll get this later here. What the heck? I've done this before. Meeting group chat. I know there's a place where I can just literally copy.